Last week, a 71-year-old woman sat across from me and started to cry. Not because of what I told her, because of what nobody had told her. For 2 years. She had been walking around with 9 warning signs already showing up on her body. Every single morning. Showing up on her feet. She thought the tingling was just age. She thought the swelling was from standing too long. She thought the cracked heels were just dry skin. She wasn't careless. She wasn't ignoring her health. She simply didn't know what she was looking at. And that is exactly why I'm making this video today. My name is Dr. Grace Wells. I'm a kidney and diabetes health educator, and I've spent the last 18 years working specifically with adults over 60. And I need you to hear this clearly. Your feet are not just the bottom of your body. They are one of the earliest warning systems your body has. For diabetes, for kidney damage, for nerve disease. By the time a standard blood test catches these problems, your body has often been sending signals for months, sometimes years. What I'm going to show you today are 9 of those signals. Things you may have already dismissed as just getting older. And for some of you watching right now, what I share in the next few minutes could genuinely change the direction of your health. So stay with me all the way through, because sign number 6 is the one that connects your feet directly to your kidneys, and it's the one most people miss the longest. Let's begin. Sign number 1. And I want you to think carefully as I describe this, because the majority of people I work with have experienced this and explained it away before I could even finish my sentence. Tingling. Numbness. That faint pins and needles feeling in your feet, especially when you haven't been sitting in a strange position. I hear it constantly. Dr. Wells, my foot just falls asleep sometimes. It happens when I cross my legs. And yes, occasional numbness from an awkward position is completely normal. I'm not talking about that. I'm talking about tingling that comes back regularly, without a clear reason, sometimes at rest, sometimes at night when you're not even moving. Here is what's actually happening inside your body. When blood sugar stays elevated over time, it begins to damage the outer protective layer of your nerves, starting with the longest ones, the ones that run all the way down to your feet. Think of your nerves like electrical cables. Each one has a protective coating around it. That coating is what allows signals to travel cleanly from your brain to your toes and back. When blood sugar stays high for too long, it acts like a slow acid wearing through that coating. The wire still works for a while, but the signals start getting fuzzy. That fuzziness is the tingling you feel. The American Diabetes Association reports that nerve damage starting in the feet affects nearly half of all people living with diabetes, and in most cases, it begins long before the diagnosis. My recommendation for you: a 20 to 30 minute walk every day. Not a run, a walk. Movement is one of the most powerful ways to keep blood flowing to those nerve endings. And start reducing added sugar in your diet, not next month, this week. Sign number 2 is the one my patients describe as the most exhausting, because it doesn't happen during the day when there are things to keep your mind busy. It happens at night. When the house is quiet, when you're trying to rest, and there is nothing between you and that burning sensation in the soles of your feet. Many people I work with blame it on long hours on their feet, or the summer heat, or circulation from sleeping in a certain position. But when a patient tells me their feet feel like they are on fire, particularly at night lying completely still, I take that very seriously. Here is what's actually happening. The nerves in your feet have been damaged by excess sugar. And now, instead of going quiet, they're misfiring. They're sending a heat message to your brain even though nothing hot is touching you. The signal is wrong, but your brain receives it as completely real. It's like a fire alarm with a faulty sensor. The building is fine, but the alarm won't stop because the sensor itself is broken. That burning is your nervous system asking for help. Research published in the journal Diabetes Care found that burning foot pain often appears 1 to 3 years before a formal diabetes diagnosis. 2 habits that genuinely make a difference. First, 8 glasses of water every day. Proper hydration helps your kidneys clear excess glucose from the blood, which directly supports nerve health. Second, more fiber at every meal. Vegetables, legumes, oats. Fiber slows sugar absorption, and that gives your nerves a far better environment to recover in. Sign number 3, and I need you to pay close attention here, because this is where things move from uncomfortable to genuinely dangerous. Dr. Wells, I had a blister from my shoe 3 weeks ago. It's still not closed. I have heard some version of that sentence more times than I can count. Most small wounds heal on their own within a few days. But when blood sugar has been elevated for a long time, that natural healing process breaks down completely. The tiny blood vessels in your feet begin to narrow and stiffen. Oxygen, healing nutrients, and the white blood cells that fight infection simply cannot reach the wound fast enough. The wound stays open, vulnerable. Think of trying to water a garden through a hose that's been badly kinked. The water exists. It's just not getting where it needs to go. That's exactly what high blood sugar does to circulation in your feet. And an open wound in a foot with poor circulation is an infection waiting to happen. The CDC reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States. Over 100,000 per year, nearly every single one of them was preceded by a small wound that someone waited on. Tonight, after your shower, sit down and look at both feet carefully, between every toe, at your heels, at the sides. If you see anything broken, clean it gently, apply an antiseptic, and cover it. And if it has not improved within 48 hours, call your doctor. Not next week, 48 hours. Sign number 4 is hiding in plain sight. People walk past it every single day. Some have been looking at it for years, and almost nobody connects what they're seeing to blood sugar. Darkening around the ankles. A deep reddish or slightly bluish tint to the skin near the lower leg. Skin that looks duller, thinner, or more fragile than the rest of your leg. Dr. Wells, I've always had darker skin there. I thought it was sun damage. It may be, but there is a specific pattern of discoloration I look for, and when I see it alongside other signs, it tells me something important about blood flow. When circulation is compromised by high blood sugar, the lower legs and feet don't receive enough fresh, oxygenated blood. The skin changes in response. Think of your blood as a delivery truck carrying oxygen and nutrients. Your feet are at the end of the longest delivery route in your entire body, further from your heart than anywhere else. When the roads narrow because of damaged blood vessels, the deliveries stop arriving. The skin, starved of fresh oxygen, changes color. It's a distress signal you can see with your own eyes, if you know what you're looking for. A study in the Journal of the American Academy of Dermatology found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis. 5 minutes every morning, ankle circles, toe raises, calf stretches. Even that small amount of movement helps push blood into the feet. And if exercise is difficult right now, elevating your feet slightly while you sit makes a meaningful difference. Sign number 5 surprises people because it looks completely ordinary. Dr. Wells, my heels crack every winter. It's just dry skin. I hear that every week, and for many people, that's exactly right. But when heels crack badly in the middle of summer, or when no moisturizer makes a lasting difference no matter how faithfully you apply it, that is a completely different conversation. Diabetes affects the nerves that control automatic body functions, the ones working quietly in the background that you never have to think about. One of those functions is regulating moisture in the skin of your feet. When these nerves are damaged, the sweat glands stop working properly, your feet lose moisture from the inside out, and no amount of lotion on the outside can fix what's being lost on the inside. Think of your skin like a sealed wall. When those internal nerves are damaged, the mortar between the bricks starts crumbling, cracks appear, and those cracks are not just cosmetic. They are open entry points for bacteria. In a foot where circulation is already compromised, that infection can escalate quickly. Moisturize your feet every night before bed. A good lotion or pure coconut oil applied thoroughly to the sole and heel, but never between the toes. Trapped moisture there creates the ideal environment for fungal infection. And drink your water. Your skin needs hydration from the inside just as much as it needs it from a bottle. I want to pause here for just a moment. We've been through 5 signs together, and I want to ask you something directly. Have you recognized any of these signs in yourself or in someone you love, a spouse, a parent, a close friend? If yes, go to the comments right now and type the number of the sign you recognized. Just the number, that's all. I read every comment on this channel, every single one. And if you have a question, ask it. That is exactly why this community exists. And if this is helping you, if this is the kind of honest conversation you've needed, hit the like button right now. It takes 1 second, and it tells YouTube to show this to more adults over 60 who need it just as much as you do. All right, let's keep going. Because sign number 6 is the one I really need you to hear. Sign number 6. And this one is not just about your feet. This one is a signal from your kidneys. Almost everyone I see with this tells me the same thing. I stand a lot, or I sit at a desk all day. And some ankle swelling at the end of a long day is normal. But I'm talking about swelling that is there most days. Swelling that leaves a deep sock mark every evening. Swelling where, if you press a finger gently into your ankle, the indentation stays there for several seconds. That is called pitting edema. And it is not something to dismiss. Here is what's actually happening. High blood sugar damages the kidneys over time. And your kidneys are responsible for something critically important. They regulate your body's fluid balance. When kidney function is compromised, fluid accumulates. And fluid, as gravity always directs, pools in the lowest place, your feet and ankles. This is why kidney health and diabetes are so deeply connected. Your feet often show the first visible sign that your kidneys are under stress, long before any kidney test would flag it. Think of your kidneys like a filtration plant for your entire body. Every drop of blood passes through them to be cleaned. When high blood sugar damages those filters, the system backs up. Fluid has nowhere to go, so it goes down. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes. And lower extremity swelling is frequently the first visible sign that kidney function is being affected. When you rest, elevate your feet above the level of your heart. Even a few inches on a pillow helps pull that accumulated fluid back toward the center of your body. Reduce sodium. Salt causes your body to retain water, and that makes swelling significantly worse. Read the labels on canned and processed foods. The numbers will surprise you. And if the swelling is new, worsening, or happening on one side only, please bring that to your doctor at your next visit. Don't wait. Sign number 7 is the one I see most often misdiagnosed. And by the time people understand what's actually going on, they've been masking it for months. Dr. Wells, I've been taking ibuprofen for my foot pain for a while. I assumed it was arthritis, maybe an old injury acting up. I hear this regularly. And sometimes that is exactly right. Arthritis is real and foot pain has many causes, but sometimes the pain has a completely different origin, one that no anti-inflammatory will ever reach. When nerves are damaged by chronic high blood sugar, they don't always go silent. Sometimes they become hyperactive. Instead of numbing out, they start firing random, intense signals that your brain reads as severe pain. Patients describe it as stabbing. Electric, like a hot needle pressing into the foot without warning. It happens most often at night when there are no other sensations competing with it. Think of a car alarm that was damaged in a minor fender bender. Every few minutes it goes off, loud, alarming, completely real to anyone who hears it. But nobody is breaking in. The alarm itself is broken. That's what a damaged nerve does. It sends alarm signals to your brain when nothing is actually happening. The pain is real, but its source is nerve dysfunction, not injury. And taking ibuprofen doesn't repair a damaged nerve. It silences a signal your body is genuinely trying to send you. And silencing that signal is the last thing you want to do. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is routinely mistaken for arthritis or age-related joint pain. Every morning, before you get out of bed, 5 minutes of gentle foot and ankle movement. Flex your feet, circle your ankles, pull your toes back gently. Get circulation moving before you put weight on your feet. And each evening, a gentle 3-minute massage along the sole and up toward the ankle. Your nerves need blood flow, and that small act delivers it. Sign number 8 tells me how long this has been progressing. Dr. Wells, I've always had cold feet. My husband has stolen the warm blanket every winter for 30 years. I smile when I hear that, because cold feet are very common. Many people simply run cold. That is not what I'm describing. I'm talking about feet that are cold in July, feet that stay cold under 2 heavy blankets while the rest of your body is perfectly warm, feet that don't respond to socks, to heat, to anything, because the cold isn't coming from the temperature in the room. It's coming from inside the blood vessels. When blood sugar has been elevated for a long time, it damages and narrows the blood vessels in the lower legs and feet. Warm, oxygenated blood simply cannot reach the tips of your feet in sufficient volume. Think of your blood vessels like pipes running heat through the rooms of your house. When those pipes narrow from damage, the heat doesn't make it to the far end. The room stays cold, no matter how hard the furnace works. That cold is not about the weather outside. It's about the state of the pipes inside. The American Heart Association identifies peripheral artery disease, caused by narrowed blood vessels, as affecting over 8 million Americans, with diabetes being the single largest risk factor. Cold feet are one of its most consistent early signs. The best response is purposeful movement. A 30-minute brisk walk every day, not a stroll, but an arm-swinging, intentional walk. This actively drives circulation into the feet, strengthens blood vessel walls, and over time can begin to reverse some of the early narrowing. Start with 10 minutes if 30 feels like too much right now. The important thing is to begin today. Sign number 9. This is the one almost nobody ever talks about, not in patient brochures, not in doctors' waiting rooms. And most people have never once connected it to blood sugar, because it happens so gradually that you simply stop noticing. During a foot exam, I look carefully at the tops of the feet and the lower legs, and sometimes there is a visible absence of hair in those areas. Not thin hair, an absence. The patient looks down and says, I never really noticed that. And that is exactly the problem. Hair follicles need a consistent, steady supply of blood and oxygen to function. When circulation is significantly impaired by long-standing elevated blood sugar, the follicles in the feet and lower legs stop receiving what they need. Over time, quietly, gradually, they stop producing hair entirely. Think of hair follicles like small plants in a garden. When the irrigation system starts to fail, not all at once, just slowly, the plants don't die overnight. They simply stop growing. The absence of growth is the message your body is sending. A message you can see with your own eyes every time you look at your legs. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients. It is a sign that physicians are specifically trained to look for, and one that patients almost never think to mention. Right after this video, Look at your lower legs and the tops of your feet. If the hair is noticeably thinner than the rest of your leg or absent entirely, schedule a blood glucose test this week, not this month, this week. A basic test costs around $12 at most certified labs, and it is covered by Medicare for the majority of you watching right now. $12 can change the entire trajectory of your health. We've been through all 9 signs together now. 9 ways your body may have already been speaking to you. Through your feet, through your nerves, through the very skin you walk on every single day. And I want to say something to you honestly. One of the hardest moments in my work is sitting with a patient who has had every one of these signs for 2 years, who dismissed every single one of them, not because they didn't care, they cared deeply, but because nobody had ever told them what they were actually looking at. You now have that information. So tonight, before you go to sleep, I want you to do just one thing. Sit down, take 30 seconds, look at your feet, really look, check the skin, check between the toes, feel for numbness, notice any wound that shouldn't be there. 30 seconds, that's all I'm asking. And if you recognize something from this list, call your doctor tomorrow, not next week, tomorrow. Because in most cases, when diabetes and kidney stress are caught early, they can be managed through changes in diet, through daily movement, through a conversation with your doctor that you now know to have. You have worked for the life you have, for your independence, for the ability to do what matters to you. Don't let something as manageable as blood sugar quietly take any of that from you, just because nobody told you what to look for. Now you know. If someone you love needs to hear this, a spouse, a sibling, a neighbor, share this video with them. You might be giving them something they didn't even know they needed. New videos every week, real conversations about kidney health, diabetes, and what living well over 60 actually requires. If this is the kind of honest, practical information you've been looking for, subscribe and bring someone you care about along with you. I'm Dr. Grace Wells. Take care of those feet, and I'll see you in the next one.